Okay, so the question again is, can we turn this into something that's useful both diagnostically and therapeutically? So if we look at some other areas like the lexicon, okay, we already mentioned total vocabulary in each language, which is an example of sort of a unique property versus conceptual vocabulary, which is an example of a common property or shared property, right? So if you are needing to intervene in the lexicon, right, where would you start? Would you start with things that are conceptually similar in both of the two languages or things that are unique? In morphosyntax, so common elements might be something like MLU, plural, or regular verbs. That is something that the languages share with each other. Again, not in an exactly identical fashion, but something the kid may say, oh, I know I have to mark plural in English with this S thing. Wow, it looks in Spanish, I got to do the same thing. Okay, yeah, there is some variation, but can we use that? We also need to assess periodically but probe regularly, because bilingual kids' skills change over time, just like monolingual kids do, across each domain. Right? And that's the aspect to think about too, is we need to be looking long range and longitudinally, not just at one or two domains of language, but looking at how each domain affects the other. So we want to measure and monitor the type and degree of interaction between the two languages and describe acceleration, deceleration, and cross-linguistic effects. Okay, so in applying this to intervention then, we need to expect interaction between the two languages. We want there to be interaction between the two languages, so that if kids know that these common elements exist, will they use those from a therapeutic standpoint? And here's at least some of the evidence. If we look at literacy, for example, ELLs taught to read in L1 had higher reading and academic achievement in L2. English phonological awareness skills were predicted by English oral proficiency, not surprising, but also by Spanish oral proficiency and Spanish phonological awareness skills. Okay, so what the Lopez and Greenfield study is saying is that kids' literacy skills in English were predicted in part, by their English, shocking, but also by their Spanish oral proficiency, that is their oral language, and also by their phonological awareness skills in Spanish. That is, so Spanish seems to be helping their English. You can look at it the other way around, but I assume the opposite would happen as well. Spanish word reading skills in kindergarten were found to be predicted than English word reading skills in first grade. Again, there's something about each of the two languages that's predicting the other. Intervention on vocabulary deficit in L1, Spanish transferred to improve skills in L2 in this case, which was English, and this is an older study by Prozzi and Sanchez. Okay, so what's our mindset then when we go into intervention? One is, instead of asking the proverbial question, in which language should I treat, the first question ought to be, what's the intervention target? So don't approach it from language first. Approach it from, what are the skills in each of the two languages? What error patterns do they have in each of the two languages? What's the frequency of those errors or error patterns in each of the two languages? And choose targets based on that information without relegating yourself or without hearkening to which language should I treat. Because I think initially that's a question, frankly, that we can't answer. That's not the first question. It comes into effect, right? We ultimately have to decide which code we're going to use. But that's not the first thing we ought to do. Right? And this information then ought to be linked from whatever comprehensive assessment that you've just done. And by comprehensive, I don't mean score on a standardized test. Right? Because that doesn't tell you anything about what those skills are. Yes, it can help you determine what the skills are. It can help you make the differential diagnosis, assuming that the test is normed appropriately for the kids that you're working with, which is sort of a dubious probability anyway. But if it does turn out that is the case, then you can use it for differential diagnosis. But it doesn't tell you necessarily anything about what skills you ought to work on in therapy. And I think that's sort of something that I think we are using standardized assessment in a way that most of them were not designed. So in other words, you can't take exactly what the child did well on or didn't do well on test and turn that into your therapy goal. Because the test was not designed, by and large, to do that in the first place. By and large, standardized tests are designed to make a differential diagnosis. Is there a problem? Is there not a problem? So the way the test is constructed, the exemplars which the child's having difficulty with might not be the things that are developmentally appropriate for treatment, or the thing that is necessarily most severe. Right? And also, typically in standardized tests, there might be one or two opportunities to produce a signal construction. Again, not enough information on which to base your therapy. Okay, so let's look at treatment from an interaction perspective. So, first one then is to select errors or error patterns with evidence of interaction. And one way to conceptualize that is to start therapy working on highly occurring or common problems in both of the two languages. Right? So you look at the errors in each language, and those that are most commonly occurring in both languages are things that you want to target first. Again, you're not yet thinking in which language should I target them. Only you're looking at the patterns and deciding which are the most appropriate targets. So things like unstressed syllable deletion, deletion of plural S, or lack of present progressive. Right? Again, which are common properties across the two languages. Then you might select errors or error patterns with little or no evidence of interaction. So patterns, for example, are errors that are highly occurring in only one language, like final consonant deletion. Right? Do you see much final consonant deletion in Spanish? No. Why not? None. Basically. Right? Very few. And especially if you're working with speakers of Caribbean dialects where S and N are weakened, deleted, non-existent in the input, right? There's even far fewer final consonants, which means, again, that it's more likely to be more highly occurring in English than it is in Spanish. It might not be a good first intervention target, right? Because there's going to be an imbalance in its frequency of occurrence. Or past tense, for example. Other things then that occur in only one language. So if you're going to work on flap and trill, what language are you going to work on them in? Spanish, because they don't exist in English. Right? Or reflexives, for example, which English doesn't really have, and Spanish has a great number of them. Right? Reflexives are robust in Spanish. English sort of has them, but has anybody ever worked on yourself, myself, himself, themselves in English? I was trying to think of a case if I ever have, and I can't. I figure if I'm working on reflexive in English, does this kid really need to be in therapy? I'm not sure. Okay, second is choose the goal attack strategy. So you're choosing your target, you're choosing the goal attack strategy, that is the way that you want to implement that particular target. So you might consider first a vertical strategy, where you teach one goal at a time until the child reaches a criterion. So the bilingual correlate is, from an interaction perspective, choose a target that's common across the two languages. Now, what's important with bilinguals, though, is you've got to monitor generalization both within and across the two languages. Well, so if you, for example, are a monolingual English-speaking therapist working with a bilingual kid, it does not excuse you, us, from looking at both languages. Right? We've got to find a way to look at what's going on in each of the two languages, even if you're intervening at that point in English. Or if you're intervening in Spanish, it's critical to know what's happening in the other language. So as an example, you might remediate plurals in English and monitor it in Spanish. Right? Ideally, what you're going to hope is that there is generalization or transfer to the other language, so that you don't have to work on it separately in the other language. Or it's closer to that criterion or expected point at the time in which you're examining it.